Welcome to Facts TV News, where everything is true. Luton Shelton knew he was loved. Bobette Shelton, the wife of leading reggae boy goal scorer Luton Shelton, said she was pleased the striker was able to feel the love and affection of the nation and the football fraternity before his passing on January 22nd. Bobette, who attended the final viewings of Shelton's body along with family members at the Tranquility Family Home in downtown Kingston yesterday, said that she was touched by the love and appreciation her husband received from the Jamaican football public throughout his illness. "I am happy that before he passed, he knew exactly how much he was loved. It was known out there that he was ill, but the support was tremendous, and I am happy for that. I want to thank everyone from across the world for the support, love, and admiration for this prolific footballer," Bobette commended. She is also happy that the public got the chance to say their final goodbyes to one of their favorite sons. "I am happy people could get the chance to see him for the last time and pay their respect, even though it is not something we are accustomed to. At least they got the opportunity to do so," she added. President of the Jamaica Football Federation, JFF, Michael Ricketts, said the federation is still grieving at the loss of an icon. "We have lost someone who would have contributed so much to the sport of football and would have been an example to not just kids in Kingston and St. Andrew, but all over Jamaica, and I hope he will motivate some youngsters to be like another Shelton," Ricketts stated. Harbourview General Manager Clyde was also pleased with the outpouring of love the former player received during his troubled time. "It is a sad day for everybody, especially the family, his friends and the football fraternity, but I must say the football fraternity really treated him with respect, honor and the reverence he deserved. He played his game well and we hope he rests in peace," he stated. The funeral service for the late Luton Shelton will take place online on Thursday morning starting at 9:30 a.m. Shelton was 35 years old at the time of his passing. He is survived by his wife, mother, and 2 children. Most attendants at yesterday's viewing wore T-shirts with RIP LS21 written on the back. Manchester School gets well-needed equipment. The Coley Mountain Primary School recently received well-needed equipment including computers, tablets, and a printer to assist teachers and students with online learning through donations from past students. The school is located in northwest Manchester and is approximately 3 miles away from My Gully. A printer valued at $361,000 was financed by past students locally and abroad. In addition, 6 used computers have been donated by past student Paul Kirby. 1 tablet was donated by past student Rose Facey and 12 by Organization of International Development Inc., New York, through the instrumentality of past student Beverly Foster. Past student Jennifer Morgan reported. She said the equipment was well needed due to changes since the onset of the novel coronavirus. "We have always been coming together and doing things, so in this crisis time of the pandemic, we saw the need for the student to be engaged in schoolwork. We found out of the 80 students on roll, 20 or less have tablets, and so we decided to go on a drive," she added. The principal said in order to get work out to the students, they need printed material because they don't have the tablets to use. "We came together and we pooled our funds and bought the printer," she added. Female prisoner dies from COVID-19. The Ministry of Health and the Department of Correctional Services, DCS, are facing strong criticism following confirmation yesterday that an inmate at the South Camp Adult Correctional Facility has died from COVID-19. But Minister without portfolio in the Ministry of National Security, Matthew Samoda, who has oversight responsibility for the DCS, has described the criticisms as incredulous and unfair. "Allow me to extend condolences to the family and friends of the inmate who has passed. But to be clear, she would not fit into the category that anyone would have called for release. She was serving either year 1 or year 2 of a 17-year sentence for causing grievous bodily harm, said Samoda. The facts are that so far, the DCS has managed the COVID pandemic very well. The fact is that we have stuck to all the guidelines issued by the international health agencies, and we have been constantly reviewed by the Ministry of Health. The infections, the rate of spread, and even the death rate in our facilities has been much lower than many of our neighboring in Central and Northern America. We continue to stick to the protocols, and we meet every Thursday morning to look at resources and ensure that they are deployed to bring about the best results, and we ensure that we stick to our responsibility and our duty of care, added Samoda. He noted that Jamaica is facing the community spread of the virus and argued that correctional facilities are not immune to what is happening in the rest of Jamaica. Our facilities do not exist in a bubble. As much as we do our best to limit external interactions, as we have said, we will have occasional outbreaks and we will stick to the protocols to keep our inmates safe, declared Samoda. Samoda, who spoke with reporters yesterday afternoon of a statement in which the DCS confirmed the death of an inmate of the female correction institution on Tuesday, stand that they have been adhering to protocols. According to the DCS, the woman, whose name is being withheld, was admitted to the Kingston Public Hospital after being hospitalized with COVID-19 symptoms on Friday, February 19th. Indicom has been informed of this development and the inmate's next of kin have been contacted, said the DCS, as it confirmed that another inmate of the facility was admitted to hospital yesterday with symptoms of COVID-19. Updates will be made to the department's communications channel and via this medium as they become available, said the DCS, whose COVID-19 dashboard yesterday showed that 200 positive cases of the virus have been confirmed so far in the island's prisons. The dashboard showed 42 active cases among inmates and wards yesterday and 26 active cases among staff. Just over 740 inmates and wards have already been subjected of COVID testing and 346 staff members. The news of the death sparked a backlash from the lobby group Stand Up for Jamaica, SUFJ, which has long warned about the danger of COVID-19 in the prisons. The most heartbreaking thing about this incident is that it could have been avoided if the Ministry of National Security had implemented the things it said it would have done, said SUFJ head Maria Carla Golato. Our constant advocacy and alarm about the COVID-19 prison cluster has fallen on deaf ears. We have consistently called for the release of low-risk inmates and for several steps to be taken to address the impact of COVID-19 on what was already an overcrowded and under-resourced correctional system. We did not have to reach this point where an inmate has died, causing fear and panic to grip the rest of the inmates' population, declared Gotler in a release. She charged that the COVID-19 numbers in Jamaica's correctional facilities have been exacerbated by the fact that Samoda has not followed through on his public statements to release the most vulnerable and those living with comorbidities. Gotler also tried Samoda for what she said was his failure to carry out his promise to improve care for bedridden and mentally ill inmates and to implement proposals to address inmates deemed unfit to plea. These matters need to be addressed urgently so that we don't have another unnecessary COVID-19 death within our correctional facilities, declared Gotler. But in response, Samoda underscored that it was never indicated as government policy that any inmate would be released early because of the pandemic. Whereas, I have great respect for the work of Ms. Gotler and her organization's effort in the area of human rights. We will have agreed to disagree this time around, and I think it is extremely unhelpful to the discussions on the projects and the plans that we are working on to bring about better rehabilitation results in our facilities, said Samoda. He added that while there is a program to relocate bedridden inmates, this will occur in the new fiscal year. According to Samoda, while this is not related to COVID, the pandemic has pushed the government to move faster to provide these inmates with a better level of care. Up to yesterday, Jamaica has recorded 406 deaths related to COVID-19, with 8,292 active cases and 268 people hospitalized. Please remember to subscribe, like, share, and click the notification bell for daily updates.